Yeah, how are you? Hope you're doing well. It's me Msao. Today I'm going to talk about reasons why we always get recurrent UTI infections. UTI, you can call it a urinary tract infection. This time I'm going to talk about in women. It always mostly affecting women, or what I can say, young girls, even elder ones, but mostly young girls. So why are you having recurrent? Recurrent is you treat them today, after some days they come back. Treat them today, after some time they come back. So why? One of the reason, or what I can say, one of the basing on the anatomy, that the women's urethra is shorter compared to a man's urethra. That's why it's mostly common to the women compared to men, that your urethra is short, like it's near, whereby in case you get a bacteria, it's easy for that bacteria to move to reach your urethra compared to a man has a longer urethra. You get. But one of the reasons why you get recurrent ofuna infection esigala nga buli sawa ebekoma busawa komawo togwa mu ddwaliro togwa ku kanula buli sawa kanula infection yemwe. Lwaki? Ensonga emu esooka, one of the reason, ladies have a tendency to, when you start treatment and you feel better, let me say you've gone to the doctor or to a msawo, they have given you treatment, or maybe say tablets for 5 days, you take for like 2 days to 3 days. Once you feel better, you stop taking the medication. If you're feeling better, doesn't mean that you're now okay, the infection has gone. No, sometimes it has just relaxed because these drugs you're taking. So when you complete the treatment, the bacteria clears away from your blood. But if you just take for a short period of time, for 2 to 3 days, the bacteria will just remain in your body in the relaxed phase. After some time it comes back. So one of the reason, incomplete treatment. So whenever you put on a treatment, always complete the dose. If it's for 7 days, complete the 7 days. If it's for 5 days, complete the 5 days. Even if you're feeling better, you have that tendency. Even if in some diseases, bw'owulirako bulungi ng'okomawo okumira eddagala, kiri advisable bakuwa eddagala lw'obulwadde bwonna malayo dose. Newankubadde owulira bulungi ng'obubonero bwonna bubuuzeewo, malayo dose. Ensonga emu. Ensonga y'okubiri, you don't want to take water always, enough water. It's advisable to always take water all the time, because when you take water all the time, this water helps to wash the urethra. It cleanses the urethra. You get. Whenever you take water all the time, remember when you take water, you're going to urinate. You'll have what we call frequent urination or frequent urination. So whenever you have this frequent urination, this water you're urinating as urine is going to help to clean the urethra where urine passes. Mulina okunywenya amazzi buli lunaku. Gy'okoma kunywenya amazzi amangi, gy'okoma n'okufuka. So omusulo guno gw'oyisa buli ssaawa gukuyambako okola ki? Okunaaza urethra yo, mu Luganda bagiyita bya sigimanyi naye abagimanyi kateeka mu inbox yawo. So okunywenya amazzi kukuyambako okola ki? Okwewala zino zi infection ezitawona buli ssaawa. Ensonga yakubiri. Ensonga y'okusatu, tugeze okwegattagatta n'omuntu nga tomanyi ayimiridde atya, like serasiye. Naye ensonga eri awo, naye oluusi weegatta n'omuntu, ate kiri advisable after having sexual intercourse, you force yourself to urinate. Urinate, remember this person you're having sex with, tomanyi wajayitira, tomanyi ali atya. So in this action of having sexual intercourse, maybe during the action, these bacteria are zisindika inside your vagina, zisindika inside. So when it's advisable after having sexual intercourse, you urinate. That urine is going to help to clean your urethra. So it's always advisable after sexual intercourse, you should always clean yourself, or should always urinate. Then another reason why you always have recurrent infections, using some detergents which are not advisable. Abamu manyi okozesa soap, biki ebyo si kirungi. That part, as I told you in my previous videos, is supposed to clean itself. So you're not advised to clean it even using water or what, or putting there your hand. Just flash their water, it's going to cleanse itself naturally. So you are advised not to put there anything. That's why you are having recurrent infections. Then another thing excuse enkomye kusonga yakuna ensonga endala, another reason why you always have recurrent infections, sometimes you have what we call delayed emptying. Nti musiba nnyo omusulo ne mulwawo kola ki ogenda okweyamba. Muntu owulya nga omusulo gukuluma olwawo ogenda emanja okola ki okweyamba. Jukira when you feel like you want to urinate, this urine you're passing out, it's like a waste product. It contains harmful, toxic chemicals. So the body is tending to go and pass them out. So for you, when you prolong them and stay with them into your restaurant, the body is going to reuse that urine again. Because sometimes when you see musulo, if you have observed it, when you see musulo, noita sera, no banga tuchagala kufuka no buza kugenzewa, the body is going to reuse this urine again. But when this urine is going to use, it already had harmful toxic chemicals. So these chemicals, some of them are going to remain into the urethra, and you end up having the infection. And then another thing, sometimes you mistake other diseases or other infections to be UTIs, and you start taking antibiotics. Recurrent use of antibiotics or frequent use of antibiotics, which are not prescribed or given to you by a doctor, also it can trigger you having recurrent infections. These antibiotics you're taking, they are going to change or alter the normal functioning of your part. It has the normal floras. You have the normal flora called the Candida albicans. Once you overtake these antibiotics are going to trigger their normal function, or it's going to decrease them into your body. So once they decrease in number, you'll be prone to getting what? This infection. So mwewala okumira amakerenda because you're feeling something paining, something itching you, so you take it to be an infection or a UTI, and you just take antibiotics from nowhere. It's very risky. Always go to the doctor to himself, explain to him or how you're feeling. To depend on how you explain out the signs and symptoms you're having, and different tests which will be carried out to rule out whether it is an infection, a UTI, or it's Candida or any other infection. Don't just take antibiotics to we dagala just because of uli damsa yampa ko de dagala nga infection nempona so nange kandimire nedda genda omusawo myole songazo akwe dagala tufu eri okumira, then mwewale nnyo okutamala edozi nga mukoze ki nga mulwadde. Mwebale nnyo bale kuwuliriza.